I'd like to welcome everyone. My name is Maisha Minter-Jordan. I'm the president and CEO of the Dimock Center. And I'd like to welcome you to our groundbreaking ceremony for the Dr. Lucy Sewell Center for Acute Treatment Services. Thank you for joining us on this historic day for the Dimock Center and our community. 1 year ago, at our 28th Stepping Out, in response to the statewide opioid epidemic, we publicly launched our Building the Road to Recovery capital campaign to rebuild and expand our inpatient detox facility. We set an initial ambitious goal to raise $15 million for a full gut renovation and expansion of our historic Sewell building, critically needed work on this beautiful building. There was a great sense of urgency to do this work to help save lives of our children, parents, friends, and colleagues. As we all know, substance use disorder affects everyone and does not discriminate. Yet, an assessment by Capital Campaign consultants, also generously supported by the Yawkey Foundations, conveyed that it would take 2 to 3 years to complete our campaign. We did not have that time. We had to work as swiftly as possible to raise the funds needed to save lives of people in Roxbury, in the city of Boston, and across the Commonwealth of Massachusetts, people who were struggling with substance use disorder and wanted desperately to get help. A little more than a year later, I'm thrilled to announce that we have successfully raised more than $16 million for the campaign. Thank you. Thank you. I am deeply grateful for the support of more than 50 campaign friends who made generous commitments, including a lead gift of $2.5 million from the Yawkey Foundations. All right. Thank you. A $5 million Commonwealth of Massachusetts appropriation, $5 million in new market tax credit allocations from Mass Development and Capital One Community Renewal Fund, with Capital One serving as tax credit investor, all 23 members of our Community Foundation Board, our 3 hospital partners, Beth Israel Deaconess Medical Center, Boston Medical Center, and partners, many dedicated first-time individual corporate and foundation supporters, and longtime Dimock friends who made incredibly generous gifts. With all of your support, we have begun the intensive work, as you see behind me, to painstakingly and lovingly upgrade, expand, and transform our Sewell building to be the home of the new Dr. Lucy Sewell Center for Acute Treatment Services. As we look at the building and think about renderings of its future, I'd like to recognize our project architects, the firm of Platt, Anderson, and Freeman, and John Freeman, who is here today in the back. Thank you. I'd also like to thank our contractor, Timberline Construction Company, and Stephen Kelly, who's also with us. Both firms have deep ties to Dimock, and we are so grateful they are partnering with us for this important work. In approximately 18 months, right, Stephen? We will be able to serve 4,000 people annually, an increase of over 1,000 over our current capacity. We will ensure that 1,000 more men and women from our neighborhood and beyond are able to get outstanding care and attention, a foundation for long-term recovery. Our new center will also house our outpatient services, supporting an important transition in our continuum of care. Thank you again for helping Dimock to reach this milestone. We're honored to have here Governor Baker, Mayor Walsh, Jim Healy, President of the Yawkey Foundations, with us this morning for our ceremony. Before I invite each of them to speak, I'd also like to invite our board chair, Flash Wiley, to come up and make a few comments.
Thank you. Wow. This is really something and part of really 150 years, Maisha, of continuing development right here on this hill in Roxbury. And we are so very happy to be a part of the latest iteration. And a lot of that has been made possible by you gentlemen that are sitting out there. And we thank you for your help. I just wanted to say one thing on behalf of the board. It is such a resounding affirmation to sit and think about and have a vision of what could be in terms of service to this community, and to plan and to raise the funds and to make all of it happen. And of course, our team leader here has been very integral to that process. Very lucky to have her. But it is so very rewarding as a board member to see this come to fruition. So thank you very much.
Thank you. So again, thank you, Flash. I'd like to invite, beginning with Governor Baker, we'll then follow up with Mayor Walsh and Jim Healy from the Yawkey Foundation. So Governor Baker, if you would, please.
Congratulations. Well, first of all, let me just start by congratulating the board and the management team and the folks here at Dimock for a tremendously successful effort to build on what, as Flash pointed out, is over a century's worth of important and significant work here in this community on behalf of people who need services and support. And I'm going to be very brief. I'm just going to say three things. The first is, people talk a lot about you can't get results until you have resources. Well, the reverse of this is also true, which is people who generate results over and over and over again over a long period of time to develop a reputation where it becomes easier, as in some cases it probably should be, to access resources. And I shook hands with Jackie Jenkins Scott a little earlier, who I used to work with back in the 90s when I was working for Bill Weld and Paul Salucci, who did tremendous work here as the leader of Dimock for many years with her leadership team in serving this community and serving the city of Boston. I then spent some time getting to know almost all of the programs that were associated with this campus. And this is about as full service a place as you're going to find in any community anywhere in the Commonwealth. And it's a tremendous tribute to the people who have been part of this organization for many, many years, that continues to be the case. And I must say, Maisha, the work that you've done since you became the CEO here has simply built on and expanded a long history and a legacy of service and excellence here in this community. And I just want to congratulate you and your team for all that you've done. And I know I speak on behalf of everybody associated with the Commonwealth of Mass and with Health and Human Services when I say we are pleased and thrilled to be part of this team and part of this initiative. We've more than increased the spending here in the Commonwealth on addiction services 50–60% since we took office over the course of the past couple of years. We've had tremendous work that's been done in prevention, education, intervention, treatment, and recovery. But we all know, based on what we see every single day, that this problem, especially on the opioid side, has tremendous negative momentum, and breaking that trend is going to require time, imagination, creativity, and investments. And this has a little bit of all of those things wrapped up in it. Maisha talked briefly about the fact that this is part of their continuum of care. Well, if you look at some of the work that we did to get a new framework for working with the federal government on a go-forward basis starting in July when our new waiver takes effect, that builds on that whole concept of continuum of care and also creates an opportunity for us to collaborate across a continuum in substance use services as well. And we're looking forward to working with people like Dimock to do everything we can here in Massachusetts to be the state that breaks the back of this particular addiction and turns this around and gives people back that chance and that opportunity to be purposeful and successful here in the city of Boston and the Commonwealth of Mass. Again, congratulations. And I don't know what my Secretary of Health and Human Services said when she was in meeting with your board and your leadership team, but I tried very hard not to say anything that would contradict whatever it was that she said, because she does represent 53% of state government, which she reminds me all the time.
She said that she'd give us all the money we said we needed.
Now, Mary Lou is a social worker, and we all know that. But we also know she's never said that to anybody, ever. But we are very fond of this place, of its history, and its commitment to this community, and to its ability over and over and over again to deliver excellence to the people that it serves. And we're proud to be part of this initiative, and we look forward to the opening of the facility some 18 months from now. Congratulations.
Thanks, Gov, and it's great to be here today. I want to first of all congratulate Dr. Minta Jordan. My first meeting as mayor of the city of Boston with her, she was talking. We did a tour, a walking tour of Dimock, and we had a chance to see the halfway houses and the detox and programs. And then she walked here and she said, "This is my dream. This is what we're going to do. We're going to turn this building around." And I want to congratulate you on your accomplishment and your dream. I want to thank you, Flash. I want to thank Bob Rivers. I want to thank the entire board for your great work here in raising the money and being here today. It's such a really quick turnover. I want to thank you for that. Mary Lou Sutters, I want to thank Mary Lou as well. I had the chance to work with Mary Lou back when I was a representative, when she was in the administration a long time ago, and now as a secretary position, she's a great partner, and Governor, she is a great partner to work with. So I want to thank you for appointing her because she gets it. Jim Haley and the Yawkey Foundation, thank you, and everyone on this list here. Thank you for your donations. Thank you for your love and support here. It truly means an awful lot to so many people. We're also joined by many elected officials, and I'm going to try and get them all. I just want to say thank you, because every single one of them in their own way is involved in recovery, whether it's at the State House fighting for funding, whether it's in the City Council fighting for funding. I want to thank them all. We're joined by two members of the State Senate. Senator Linda Docina-Fori is with us, and State Senator John Keenan from Quincy, who's a champion in recovery. Thank you very much. We have three members of the legislature. We have Representative China Tyler, newly elected. Thank you, Representative, for your great work, and you're going to be doing great work. State Representative Jeffrey Sanchez, who's doing this for a long time on health care, financing, and policy. I don't know if she's here. I didn't see her come in, but I want to mention, because I know she'll probably will be coming. Oh, there she is. State Representative Liz Meyer, who is a champion, and I had many great fights with Liz together fighting for recovery services. John Keenan just reminded me of one, Liz, in a budget debate where we're getting the first run of the prescription monitoring program, where we might have threatened to shut the place down, and we got it at 11:15 that night. I want to thank you. We have some city councilors here. I want to thank City Councilor Nisha Sabi George is here. I want to thank you. And I didn't see him, but I think City Councilor Tito Jackson is here as well somewhere. And any other councilors, if I missed you, I apologize. I can't really see into the tent that well. I'm going to be quick because it's getting cold. 150 years, as Flash Wiley said, this campus has been doing incredible things. 150 years. When you start to look around in our world today, not many institutions are around that long. In this institution, Dimock has provided health care and a safety net for so many different people. Affordable care, primary care, doctors are here. Mental health professionals, social service providers are all working. This treatment center behind us, I was just sitting, listening, and thinking about what do you say. And today and yesterday and tomorrow, there are people sitting in their homes. They're in a dark place. The shades are drawn, the windows are closed. They feel that there's no one that loves them. And what helps them out of that is a building like we're doing here today. Because when people walk through this door here, they're going to think their life is over. They're going to think they have no place to turn, they don't want to talk to, they don't know what to do. And they're not going to realize when they walk out of this door, when they leave their treatment facility, what the opportunity, what the potential is. There's a potential that someday some young person is going to walk through this door thinking that their life is over, and they're going to walk out, and someday they're going to be the mayor of the city of Boston. There's going to be other people. There is other people that are going to walk through this door and come out, and they might run the NAACP. I see Michael Curry here. They might be a president of a bank. They might be the chair of the board. They might be a state representative. That might just be somebody who works for Public Works Department and is able to raise their family. So I want to thank everyone here today financially who made this possible. This is more than a renovation. This is more than a renovation that we're happening here today. Dr. Jordan understands that. The board here understands that. The counselors, the clinicians, the social workers, the folks that have graduated the halfway house across the street here, the folks that have walked through the door know how important this is and what this means. I want to thank the governor and the legislature for the funding that they provided to recovery services. When we think about what's going on in the world, we spent a lot of time, and this week we have a presidential inauguration on Friday, and with the pundits are going back and forth talking about how bad it is or how good it is or what's going to happen. But really what happens is the work that happens on the ground. It doesn't really matter what the conversations are all about. It's what the work happens on the ground. And what we're doing here today is a new beginning for this building and a new beginning for Dimock to be able to continue to move forward and bring the process they've shown and bring the services they want to the streets. When Dr. Jordan took me around here and we walked through here, I could see in her face the joy that she had in what was going to happen here. And she said to me, I would like to do it sooner rather than later, but I don't know if she fully meant or wanted to make it happen within 3 years. So when you think about what's happened here, it absolutely is incredible what's happened here in 3 years. It's an honor for me to be here today to help break ground on this new facility, but it's also an honor for me to say thank you to all of the people who made today possible. Because if you weren't here, we can put as much money into recovery services and we can try and do things, but if we don't have facilities that give people proper treatment, with proper wraparound services, with proper follow-up care, the last thing I just want to say is when somebody comes on this campus and they walk in this building, they get the treatment. It doesn't mean their treatment ends when they leave, because there's going to be wraparound services in this place, and they can go across the street to a halfway house, or they can go to job training on this campus. This campus does it all. We are very fortunate to have the Dimock Center, not just in the city of Boston, but in the Commonwealth of Massachusetts. Thank you very much.
Thank you, Maisha, and thank you, Governor Baker and Mayor Walsh, for your wonderful support and enthusiasm for Dimock. When the Yawkey Foundation learned about the significant needs for the Sewell building, we were immediately struck by the incredible potential of this project. We envisioned a building that is beautiful and welcoming in its layout and its amenities, and efficiently designed to maximize space to ensure the highest quality of treatment for its patients. We also envisioned the impact of the work being done within its walls each day, life-saving work. The Yawkey Foundation's support of building the road to recovery represents a special moment in our relationship with the Dimock Center. In 1988, Gene Yawkey directed the Red Sox to support Dimock for stepping out, including having the Red Sox Vice President Elaine Stewart chair the event in 1990. The support from the Red Sox Yawkey ownership continued until the team was sold. The foundation's ties with Dimock began 25 years ago and have only grown stronger over the decades. The Dimock Center and its leaders have a keen understanding of the needs of our community and continually evolve their programs and efforts to respond to these needs. The Dimock Center was founded in 1862 as the New England Hospital for Women and Children. Dr. Lucy Sewell came to the hospital in 1863, became director in 1869, and was the director when this building was built in 1880. Dr. Sewell pioneered the training of women in medicine and devoted much of her medical practice to the care of disadvantaged women and children in Boston.
we were inspired to name the new inpatient detoxification center for Dr. Lucy Sewell, a Dimock pioneer and leader whose work on this campus in its earliest days was indeed transformative. On behalf of the trustees of the Yawkey Foundation, we are thrilled and honored to be part of the historic moment at Dimock. Congratulations to Maisha and the board for your wonderful milestone. Thank you.
So I'd like to just present some small gifts of appreciation to the governor, mayor, Secretary Sutters, and Jim Healy. So bear with me one moment. Secretary Sutters. I don't want to step on her. Mayor Walsh. Governor. And finally, to the Yawkey Foundation. So at this point, I'd like to invite Governor Baker, Mayor Walsh, Secretary Sutters, Jim Healy to do our groundbreaking.
1, 2, 3, go! Yay!